Typhoid fever remains a deadly reality for millions today. Lurking in contaminated water and food, typhoid fever is a silent threat. The World Health Organization reports millions of cases annually. While treatable, it can be deadly if not promptly addressed. Drug-resistant strains complicate the fight, demanding a multi-pronged approach. Typhoid fever paints a stark picture of global health disparity. It disproportionately affects low and middle-income countries, particularly in Asia, Africa, and South America. This uneven distribution highlights the critical link between poverty, inadequate sanitation, and the spread of preventable diseases. The lack of access to safe drinking water and proper sanitation systems creates fertile ground for typhoid transmission, perpetuating a vicious cycle of disease and poverty. Children are particularly vulnerable to typhoid fever. They are more likely to suffer from severe complications, including intestinal bleeding, pneumonia, and meningitis. The impact of typhoid fever extends beyond immediate health consequences. It places a significant burden on healthcare systems, economies, and overall societal well-being. Addressing this global health threat requires a concerted effort from governments, healthcare providers, and individuals alike. It demands a commitment to investing in public health infrastructure, improving sanitation, and ensuring access to clean water for all. To effectively combat typhoid fever, we must understand its pathogenesis. This involves examining the interplay between three key elements: the agent, the host, and the environment. This interconnectedness, often referred to as the epidemiological triad, provides a framework for understanding disease transmission and developing effective control strategies. The agent responsible for typhoid fever is a bacterium called Salmonella typhi. This bacterium thrives in contaminated water and food, often finding its way into the environment through human feces. Humans serve as the primary host for Salmonella typhi. Once ingested, the bacteria multiply in the intestines and spread through the bloodstream, causing a range of symptoms. The environment plays a critical role in the transmission of typhoid fever. Poor sanitation, inadequate sewage systems, and contaminated water sources create ideal conditions for bacterial proliferation and spread. Typhoid fever spreads primarily through the fecal-oral route. This means that the bacteria are shed in the feces of infected individuals and can contaminate food and water sources if proper sanitation and hygiene practices are not in place. Imagine a scenario where an individual with typhoid fever uses a toilet that lacks proper sanitation. The bacteria from their feces can seep into groundwater, contaminating nearby wells or water sources. Consumption of contaminated food is another common mode of transmission. Street food vendors, in particular, can unknowingly become vectors for typhoid if they do not have access to clean water and proper hand-washing facilities. Even fruits and vegetables washed with contaminated water can harbor the bacteria, highlighting the importance of thorough cooking and safe food handling practices. The cycle continues as long as contaminated water and food sources remain accessible. This underscores the critical need for improved sanitation infrastructure, safe water supply chains, and widespread education on hygiene practices. Resistance, a growing challenge in typhoid treatment. For decades, antibiotics have been the cornerstone of typhoid fever treatment. However, the emergence and spread of multi-drug resistant strains of Salmonella typhi pose a significant threat to global health. These resistant strains are not effectively killed by commonly used antibiotics, making treatment more challenging and increasing the risk of complications and death. The rise of antibiotic resistance is a complex issue driven by several factors, including the overuse and misuse of antibiotics in humans and animals. When antibiotics are used inappropriately, they exert selective pressure on bacterial populations, favoring the survival and proliferation of resistant strains. The widespread use of antibiotics in agriculture, particularly as growth promoters in livestock, further contributes to the problem. The resistant bacteria can then spread to humans through the food chain, creating a vicious cycle of resistance. Recognizing the sign's clinical presentation of typhoid fever. Recognizing typhoid fever symptoms is crucial for prompt diagnosis. The disease presents with non-specific symptoms, making diagnosis challenging. A hallmark symptom is a high fever, often exceeding 103 degrees Fahrenheit. Gastrointestinal symptoms like abdominal pain, constipation, or diarrhea are common. In some cases, a rose-colored rash known as rose spots may appear. Unmasking the silent fever. Diagnosing typhoid fever can be challenging, especially in areas where other febrile illnesses are prevalent. Clinical symptoms alone are often not enough to make a definitive diagnosis. Laboratory tests are essential to confirm the presence of Salmonella typhi infection. Blood culture is the gold standard for diagnosing typhoid fever. This test involves taking a blood sample and incubating it in a laboratory setting to allow any bacteria present to grow and be identified. While blood culture is highly accurate, it can take several days to obtain results, delaying treatment. Other diagnostic tests, such as Widal test and stool cultures, may be used in specific situations, but are generally less sensitive than blood cultures. Combating typhoid treatment strategies and challenges. Prompt treatment with appropriate antibiotics is crucial for managing typhoid fever and preventing complications. The choice of antibiotic depends on local resistance patterns and the severity of the infection. Fluoroquinolones, such as ciprofloxacin, have been the mainstay of treatment for many years. However, the increasing prevalence of fluoroquinolone-resistant strains has led to the use of alternative antibiotics, such as ceftriaxone and azithromycin. Treatment of typhoid fever is not without its challenges. In some cases, combination therapy with multiple antibiotics may be necessary to effectively eradicate the infection. The duration of antibiotic treatment typically ranges from 7 to 14 days, depending on the severity of the infection and the individual's response to therapy. Prevention is key, breaking the cycle of typhoid transmission. Preventing typhoid fever requires a multifaceted approach. Improving sanitation and hygiene practices is paramount. Access to safe drinking water and proper sanitation facilities is fundamental. This includes investing in infrastructure for safe water storage and distribution. Hand washing with soap and water is one of the most effective ways to prevent typhoid. Vaccines play a crucial role in preventing typhoid fever. A healthier future, our collective responsibility. Typhoid fever remains a significant global health challenge, but it is a preventable and treatable disease. By understanding its transmission pathways, clinical presentation, and treatment options, we can work towards its control and eventual eradication. Our collective efforts must focus on improving sanitation and hygiene, ensuring access to clean water, promoting vaccination, and strengthening healthcare systems. We must move beyond awareness to action, advocating for increased investment in public health infrastructure and promoting equitable access to healthcare resources. Let us work together to create a world where typhoid fever is no longer a silent threat, but a distant memory. The fight against typhoid is a fight for global health equity, a fight for a healthier and more just world for all.